Good afternoon, my name is Dr. Joe O'Neill. I'm a neurodevelopmental pediatrician at Riley Hospital for Children. I'd like to take some time this afternoon to talk with you about concussions and what it means for the student athlete and what it means for schools. I'd like to thank the Indiana Department of Education for allowing us to take this time to talk about, to me, is a very important matter in terms of the safety and welfare of our young athletes, and that's mild traumatic brain injury, also known as concussions. I'd like to acknowledge the individuals at the Centers for Disease Control and Prevention who have helped to put out this material on concussions and have been a leader in helping to set goals and recommendations for concussion management. Just to be upfront, I have no financial interests or be discussing any type of treatment plan or any type of intervention that's not standard of care. So today what we're going to talk about is an overview, an introduction about what we mean by concussions, what type of history do we need to take, the signs and symptoms, and then we're going to briefly talk about management on the field or in the playground or in the school. And then how do we get these athletes or these young people back safely to competition, whether it be practice or play. And I'll touch briefly on the role of neurocognitive testing. We know that concussions are very common. We estimate that there's over 3 million concussions each year that occur during the sporting event, whether it be practice or play. In the past, we used to only think that there's perhaps even a tenth of those, and what we've come to find out is that we grossly underestimated the number of concussions and mild traumatic brain injuries that occur during sports. And so there's been a number of studies that have looked at the underreporting, and so what I think it means for us who take care of young athletes and students and children is that we really need to be on guard, to look for concussions, to be aware of the risks, and be able to provide appropriate care for our young people. So what do we mean by concussion? I was an athlete. I played high school football and I boxed in college, so I know personally what it's like to suffer a concussion. But from a medical standpoint, concussion is defined as a complex pathophysiological process that affects the brain, and it's induced by a traumatic biomechanical force. What does that mean specifically? Well, there are several common features. It's a force transmitted to the head. Not necessarily have to have the head hit the ground or hit something, another person or a bar or a pole, but it could be a force that's transmitted to the head through rapid acceleration or deacceleration. The onset is very rapid, it's short-lived impairment, and it reflects in acute symptoms that show a functional disturbance. Remember, the brain is a functional organ. It's not like a muscle or some other internal organ that has another function other than what the brain does best, is what is known as thinking. It's functional. You know, a lot of times we see a broken arm, you'll see an angulation in the bone or swelling. You'll see on a muscle that's torn or bruised, some bruising around there, some discoloration. We don't see that with the brain because it's encased in the skull. And so what we look at is how the individual functions after sustaining that injury. The good news is most everyone who gets a concussion will get better. And the resolution of the concussion symptoms follow a pattern that is sequential and one that we can follow with the athlete to make sure that they're progressing along. And I put down here we have normal neuroimaging studies because the data tells us that we don't necessarily need to get an MRI or a CT on every athlete that gets head trauma. So how do we recognize concussions? It's easy if there's the athlete or the young person's knocked unconscious, but very few, less than 10% of concussions result with a loss of consciousness. So what we really need is a history or witnessing a forceful blow to the head or body that results in rapid movement of the head. And then what we see is a change in how that athlete thinks or how they behave or how they function. You know, there are some things that are very important, and we'll review several times the important points. All concussions are serious. Not all concussions need to have loss of consciousness. In fact, most concussions do not have loss of consciousness. And it's important to recognize and provide proper response to a concussion so we can get these young people back into participation in sports or into school quickly and safely and prevent further injury or death. Where do concussions happen? For younger children under the age of 14, a lot of it happens off of the school property. A lot of these are from bicycling and emphasizes the importance of why children should wear bicycle helmets when they ride a bike. A lot of unintentional injuries occur on the playground or doing other type of activities. For younger children, there's a fairly even distribution between basketball and football and soccer for head injuries. For the older athlete or adolescent who's in high school, it's less of those that occur off the school property and more inclined to be during a sporting activity. The leading cause is football, as we would expect, but there's a fairly significant number of male and female athletes who suffer concussions in basketball and soccer, baseball, and hockey. So what are some of the risk factors for sustaining a concussion? Well, we wonder about helmets and protective equipment. The truth is a helmet does not protect against a concussion. It protects against catastrophic head injury, such as a skull fracture. The player position and the game speed. You may recognize this picture as Austin Collie of the Colts. As you know, several years ago he sustained multiple concussions, and he had protective helmets, and he still is at risk for concussions. When we think about the size of the player and the game speed and their style of playing, obviously these children here have a much different playing style, speed, and size than do, for example, these players. And so the amount of energy that's transmitted from one player to another, or when a player hits the ground, is greater in the older, bigger, faster, stronger athlete. Also have to worry about prior injuries. Is this the athlete's first concussion, second concussion, or higher? Also wonder about the individual anatomy and their prior medical history. Is this a child or an adolescent or an athlete that's had a history of migraine headaches, had a history of prior brain trauma, may perhaps have some sort of brain malformation that may or may not be known. So those individual anatomic issues are important. We worry about the field surface. It's been tried several times to make the playing surface more forgiving to prevent energy transfer during an injury, but it's very difficult to make ice softer. You can't make a basketball court softer. And so there's been, even though we have tried to make playing surfaces better, the playing surface and the transfer of energy is pretty constant. So in terms of the sideline, gym, or playground evaluation, important thing to remember is that anytime you have a head injury, you may have a neck injury. And so it's very important to keep that young athlete in a neutral, what we call a neutral position, looking forward so that they're not putting any extra stress on their neck. And if there's any concern of neck injury, leave the helmet on and have bolt cutters or tools to be able to take away the face mask in football, or gently be able to safely take off any access to the airway for other types of sports. Looking at the athlete's critical. You need to know what the athlete is like before and after the event. So getting to know your athlete is very important. If after that particular event where the athlete sustains a serious hit, is the athlete dazed? Are they confused? Are they forgetful? Do they forget what quarter it is or what the score is or who they're playing? Do they seem more clumsy? Do they complain of headaches or that they're nauseated? Do they act like they have blurred vision? Do they act like they are sensitive to light or to noise? Or they're just saying, you know, coach, I'm just not feeling right. So if you're in doubt, sit them out. And if you think they're seriously injured, get a hold of emergency personnel, especially if there's no medical person or athletic trainers at the sideline or in the gym. If you're really concerned, have them taken to the hospital for an evaluation, especially if the symptoms are getting worse or they tend to be persistent symptoms. So let's take a moment and look at what type of symptoms that the student athlete may tell you, especially in school. And this may not necessarily be right at the time of the event. Sometimes concussion symptoms can occur several hours after the injury occurs. So some things that the student might report is that they're having problems thinking, concentrating, remember things. They're difficulty thinking clearly, that their thought processes aren't as sharp. They're not concentrating. They're reading something 2 or 3 times just to remember it. They feel more sluggish or slowed down, like they're in a haze or foggy or groggy. And these are kids who are generally smart. They're missing questions, or a child who's had good grades and they just can't finish their tests on time, and they're just not doing what you would expect them to typically do. They may complain of some physical symptoms, such as, I got this pressure in my head. I feel like someone's squeezing my head, or I have a headache. I've just been sick to my stomach and I threw up a couple times. I'm just not as coordinated. I feel dizzy. My balance is off. And I've been really tired. And, I have to blink and I have to squint to be able to see it. Things are just not quite as sharp as they used to be. The light or the noise, it's just something that I can't listen to my music because it sounds like it's too loud, or the street noises or horns blaring. Just way too loud. Or the fluorescent lights in the classroom hurt my eyes. They may have numbness or tingling, like they're got on a vibrations are going through their body, or they just don't feel like things aren't right. Those are important things to listen to, and make sure that you pay attention to them and get them to appropriate medical care. Sometimes the kids will be more emotional. They may be irritable, just madder than heck, and you don't know why. They're sad. Something that you said, they'll just break out and either laugh or cry, and it wasn't anything that you thought you said was extraordinarily different than what you normally talk to them about. Or they may act like they're more nervous, more fidgety. Sleep. Sleep is often disrupted by concussions, especially if the injury occurred the previous day. Ask them, how'd you sleep last night? Or have you been drowsy? Are you sleeping more than normal, or did you have trouble falling asleep? Concussions can affect both ends of the sleep spectrum. What might you see in the athletic office, in the training room? What might you see in the classroom or the principal's office? They may be dazed, or they may not be acting quite right. They may be confused by what you're talking about. They may answer questions slowly, or they may repeat things to you slowly. They won't recall what happened before the event, or they may not recall what happened after the event. And amnesia is an important factor to consider and to keep track of. They may or may not have had a loss of consciousness. They may be irritable, or they have emotional changes, as we talked about, or they may feel slow or more tired. So on the sideline evaluation by the medical staff should conduct a full neurologic exam, strength, coordination, mental status, and there's some very good tools out there, such as the SCAT, to be able to have a good feel for what's going on with that young athlete. The cognitive exam, describe the incident. What happened to you? What was the play that you called? What's the score? Who are we playing? What was this play that we called? What quarter is it? Those are important things to ask to see if they're remembering and what the function of their brain's doing. Standard orientation questions are insensitive, like who's the president, what day of the week, what month of the year. We found that those don't help as much as specific questions about what they were doing at the time of the event. Sometimes facial expressions, just a blank stare or grimacing or blinking their eyes a lot may help. Exertion tests, if you're not sure, have them run up and down the sidelines, or do a set of stairs up and down, or something to get their heart rate up, and that may elicit more signs that shows that they've had that there's something wrong and they may have sustained a concussion. Oftentimes there are red flags that we want to pay attention to. Most concussions get better, and most of the kids do just fine. However, Rarely a dangerous blood clot may happen and form on the brain after a blow to the head and may actually crowd or push the brain up against the skull. If that happens and you see symptoms that you're concerned that this may be going on, get them to the nearest emergency department. Now, some of the danger signs that we would want you to look for. If one pupil of the eye looks different or larger than the other. If they're drowsy and they can't be woken up. If the headache gets worse and doesn't go away. If there's any weakness, numbness, or decreased coordination, repeated vomiting or nausea, and we can expect to see 1 or 2 episodes of throwing up, but if it continues, then we get more than that, I would be very concerned. If there's any type of slurred speech, that you can't understand what they're saying, or if there's seizures or any type of convulsions, if they don't recognize you or recognize familiar people, or if they become increasingly confused, restless, or agitated, or if they lose consciousness. Even a brief loss of consciousness should be taken seriously. So if any of these red flags are present for that young student or athlete, make sure we get them promptly to medical care. What's some important information we should know when dealing with our student athletes that have concussions? Is this their first concussion? Is this the first time they've had this event, or if they've had more than one concussion? And the important thing about this is that each subsequent concussion takes longer to get better. In fact, an athlete who has sustained one concussion is more likely to get another. What is this personal history of any mood disorders? Do they have any history of depression, bipolar disorder? Do they have attention deficit disorder with hyperactivity? Do they have any learning problems or learning disabilities? Do they have a history of migraine headaches? And a family history of headaches is also important, especially the migraines. What is their academic history? Is this a student who was getting great grades and now is not doing well? What is the age? Because we know that concussions are very much based, and their recovery are very much based on the student's age. So what about some of the management? Once again, on the field, if you are in doubt, sit them down and get someone to take a look at them immediately following the injury. So that whether it be yourself or a trainer or a doctor who's on the field, it's important to have them available to take a look at the athlete. The important thing that I always try to tell coaches is that if it's, for example, a football player, take their helmet. If it's a hockey player, take their stick. Or if it's a lacrosse player, take their stick. You know, it's important because they can't go back on the field if they don't have that piece of equipment. And so the next thing to remember is that you can't leave them on the bench and just go on and let the game progress. Someone needs to be following that student very closely and talking to them throughout that period of time during the game, especially during halftime, see how well they're doing. And then afterwards, in the second half of the contest, make sure that someone's keeping an eye on that person. Oftentimes we'll hear of a young person who has sustained a concussion and then has a bad outcome because they had progression of their symptoms and nobody was paying attention. So it's really important that someone keep track of that individual and that they keep a close eye on them and keep them from going back into the contest by taking an important piece of equipment. The good news is most of our kids will get better after they have a concussion. And as they get ready to return to practice and to play, it follows a stepwise process. That is one that is, I think, very important for us to look at. So when they get better, what is their prognosis or how quickly they get better depend on? You know, if this is their first concussion or their second or third, it may take longer with each concussion. And how well are they going to comply with medical advice? A lot of times we'll see kids who keep coming back for symptoms and we ask them what they've been doing. Well, they haven't been doing what we asked them to do, and we're going to go through that. Once again, is there any personal history of any mood disorders like depression, bipolar disorder, attention deficit disorder? Are they on any medications? Do they have any learning problems or learning disability? The family history of headaches is important, their academic history, and their age. So generally, you know, as I said, the good news is most athletes get better. 90% of these kids will be back to normal functioning fairly quickly. The rough guidelines for adults, it takes about up to a week. For a college student, it may take 7 to 10 days. High school student may take over 2 weeks. Junior high may take at least 3 weeks or longer. And under age 12, we really don't have good data. And frankly, we really don't have good data for the junior high students, although we're working on that. It may take 4 weeks or more for a younger student to get better after a mild traumatic brain injury. So what do we mean by recovery? They need to have no symptoms while at rest. And that includes going through the school day and being able to do all their schoolwork. Because if they can't go to school and get their work done, they're not ready for any type of athletic participation. And by that I mean no symptoms. Their energy should be good. They shouldn't be having headaches. They shouldn't be having any neurological symptoms. And then the next thing that we do is that we test them with exertion. Once again, they should have no symptoms with cognitive work. So they should be able to get through their homework okay before we go on to the next athletic type of exertion. They should have normal neurocognitive function and have normal testing scores. And the good news is most students get better with the proper management. So once they're asymptomatic, going through the day, going through school, then they can come back to the trainer and get clearance from their physician to go back to competition, whether it be practice or play. The other thing to remember is that they should be seeking care from a physician who's been trained in the proper management of concussions. In Indiana, we're very fortunate that we have a number of physicians who have taken classes on and had special training on how to manage concussions. And so they are able to be providing better, more complete care for that student athlete. So the return to play protocol involves no activity, complete rest, especially after the concussion. By that I mean they should not be playing video games, they shouldn't be talking on the phone, they shouldn't be watching TV to a large extent. They should be careful doing homework. If it makes their symptoms worse, they need to stop it. Then once they're completely asymptomatic or without symptoms, they can try some light aerobic exercise. No resistance training because that could bring on symptoms. Now if they make it through that, then we'll allow them to do some sports-specific exercises, some light resistance training. Now if they're okay the next day, then they can do some non-contact training drills. If they're okay with that and show no further symptoms, then they can go to full contact training and practice. And if they're okay with that, then they can go back to game play. You can't combine different components of this protocol in one day. So you couldn't go from sport-specific exercise into non-contact training drills. Each day it should be a progression each day per protocol component. We'll talk a little bit about neurocognitive testing. It's relatively new. It's been around for about 10 years now, and it's been a valuable tool to help us decide when a student athlete or anyone who suffers a mild traumatic brain injury is able to be back to their normal cognitive functioning. Because you can have neurologic symptoms even though you look normal. Your brain's a functional organ, and it may not be functioning correctly even though you may look perfectly normal. It helps us to clarify and objectify some vague or seemingly minor complaints. Many times we wonder, is the patient lying or are they malingering? What if they have a prior history of headaches or depression, and that's confounding our ability to judge how well they're getting better. And it's an important determinant in case we have young athletes who have persistent symptoms like post-concussive stress syndrome or other types of headaches or problems after the concussion. Now there's a lot of them around. There's a number of tests, IMPACT, CogSport, HeadMinder, and the ANAM, which is from the United States Army. I am not recommending any one of these. In central Indiana, most physicians are familiar with the IMPACT testing. What are some of the complications of concussions? Well, the first one would be post-concussion syndrome, and the second, much more serious, would be the second impact syndrome. Post-concussion syndrome, it's symptoms that will last longer than 4 weeks. See that in about 25% of those individuals who suffer concussions. It's a complex interactions between the symptoms and their functioning. You may see issues with chronic pain, such as chronic headaches or fatigue. Psychosocial problems, the athlete may be depressed, or the young person may have emotional lability. Could be a lot of different types of problems. Academic work can be a nightmare for these children, and that's why it's important to have people in the schools who are familiar with the management of concussions from a school perspective. For the evaluation of post-concussion syndrome, we may or may not need to do extra neurological testing or neuroimaging studies. We may do an MRI of the brain, a formal neuropsychological exam, sometimes using neuropsych and neurocognitive testing. We may need to screen for a young person to see if they may have ADHD or some type of depression that may be confounding his or her recovery, and we need to treat those symptoms. Oftentimes we'll use medication like tricyclic antidepressants for headache, or sometimes some sleep aids for sleep problems. We may sometimes have to treat their attention deficit disorder with medications. Briefly about second impact syndrome. It was first described in 1984, and although I say here that it exists as controversial, I think the current feeling among medical professionals is that this is truly a serious condition that needs to be paid attention to. It happens because the brain is re-injured during a vulnerable period before it has a chance to heal completely. And what happens is that in these unfortunate athletes, there's after that second concussion, before their brain has a chance to heal, there's massive cerebral blood flow. Things go haywire within the brain. All sorts of dysregulation occurs. Electrolytes and electrical signals in the brain are becoming completely confused and disoriented, and you will see swelling of the brain, and frequently you may get brain herniation, which can be catastrophic. One of the young men who suffered this and brought a lot of attention to us, a young man by the name of Leidert. And you see a picture of him right here. He's number 55, and this was in a game before he had his second concussion. He had a second impact syndrome, and that's him afterwards in the wheelchair with a tracheostomy tube. So these are important sequelae that can happen from a concussion. These are important outcomes that we need to keep in our minds so that we don't allow that to happen to our athletes. So when do we say enough's enough? It's rare. We understand how important sports can be to our young people, and we know that it's a very big thing to ask of them to stop participating. But when a concussion doesn't get better, if they still have physical symptoms, cognitive symptoms, emotional symptoms, even though they may want to play, it may not be in their best interest. Or when they start getting concussions with less and less impact or force, that's when we might say to them, it might be time to find another sport or stop playing this particular sport. So to summarize, we've covered a lot of information about concussions today. The important thing to remember is that each concussion should be assessed and managed on an individual basis, and each individual child and athlete and student should have a return to play that's geared to their special needs. And this just isn't a student athlete, but this could be the student in the hallway that slips and falls. It could be the young person that's injured during gym class. Any student athlete, or for that matter, teacher or staff member who sustains a mild traumatic brain injury. Don't forget that these individuals need rest. Cognitive rest is essential to them getting better. If you remember that the brain is a thinking organ, that everything that our body does is controlled by the brain. So by allowing them to rest and have cognitive rest, they'll get better quicker. We want normal neurocognitive testing that's being conducted and monitored and by a psychologist or a physician who's trained in the concussion management. There should be no progression of activities until they're symptom-free. That includes getting back into school. The athlete should be, or the individual who has a concussion should be without symptoms should be able to be without symptoms at the end of the school day and be able to do all their homework or all their office work and class work and still have no symptoms come back or get worse. Then we want to see a progression of activities and exertion back to game time activities and conditions as I discussed. And if there's post-concussion symptoms, I would like to recommend that there's aggressive management for evaluation as well as treatment. And oftentimes, if needed, we'll use medications early on. And it's important to remember that they're not able to get back until they are symptom-free off of medication if they don't have a prior condition. I'd like to take just a quick minute and talk about Senate Bill 93, which was passed in 2011. This is based off of work that was done in the state of Washington, and is now these laws are being passed across the country for the protection of young athletes. And what it says is that each year a high school student and the student's athlete's parents are given information concerning head trauma and head injuries and concussions, and return a form acknowledging the receipt of this information. So they should know what they're about concussions and how serious they are. And that information should be given to the student's coach. It requires that a high school student athlete, and we say high school student athlete, but really any athlete who is suspected of sustaining a head injury or concussion needs to be removed from play at the time of the injury. It provides that the student athlete may not return to play until they've been evaluated and received written clearance from a licensed healthcare provider who is trained in the management of head injuries. I want to thank you for your time and your attention to this very important topic. Having been a former athlete who sustained concussions, I understand the drive to get back into play. However, as a physician, I also understand how fragile the human brain is and how important it is for us to give to our young athletes the proper care and protection. Thank you very much.